Welcome to Beyond the Breakwater, where just beyond the crashing waves of fear, discomfort, and doubt lies the greatest potential for life transformation. We want to guide you into the open waters where the calculated risk you take becomes the turning point for you or your organization to thrive. So draw up your anchors and prepare for departure in this week's episode of Beyond the Breakwater. Welcome back to another episode of Beyond the Breakwater. I'm here with Ed and our special guest, Jim Mier.
Hi.
So welcome.
Thanks for having me again.
Yeah, we're super glad to have you here and just kind of talk about more of what Gateway Healthcare is. In the past episodes, we've started bringing on the ministry managers. We've had Marcia from The Bridge. We've had Mike from His Hands, Matt from Pivot Point. So now you are no, there's still more. You are just our next target.
Okay.
You're in the hot seat, John.
Yeah,
Yes.
I guess so.
Yeah, so we like to give listeners kind of just a window into the ministries because they've been hearing us talk about them and just pieces here and there, but really each ministry is just so special, and so we like to give as much airtime to them as we can and just give listeners an idea of what happens within the walls of Gateway every single day that might just, you say the church has a healthcare clinic and you're like, what? Yeah, but like what really happens in there? So Jim, maybe just introduce yourself first, like what led you to this? What's been your work history? Okay. Where did all this start?
All right. Well, again, my name's Jim Mier. My background was actually IT, project management. I did that for about 40 years.
Wow.
So how I got linked up with Ed was through the church. Actually, through the Bridge Food Center, I volunteered to help out to get that started and helped set up some of the IT needs there. So my background's been, task-oriented, get things done. So why Gateway or why healthcare? Ed he gave me a call. I think I might have been in Florida or something. I've been retired for 7 years now. And about 3 years ago, Ed, I think you called me, didn't you?
I don't remember.
Certain. I think I was.
Lots happened between then.
Yeah, I think I was in Florida and living the life of a retired person.
How's that going for you?
Not so good right now, but he just said, I got an opportunity when you get back to talk about getting into healthcare, and I just said I'm in because. The need is just, it's just incredible. I mean,
how did you recognize that as a need? Like, what led you to be like, oh, we're going to start a healthcare clinic? Jim Mier. Like, why did you think of Jim?
I don't know if I can answer why I did. I just somewhere along the way.
Probably because I was on the board.
And I just wanted to talk to him about it. But I think it surprised me when I asked you about it that you were all in.
Yeah.
So why were you so on board for healthcare specifically?
I think God planted it in my heart. I can't explain it really. I mean, it was just, let's do it. I guess maybe I like a challenge too, and I found one.
I think it's more than that because you said something to me that was really, that has stuck with me when I was really questioning, is this really the right move or not? Do you remember what you told me?
Oh, yeah.
What did you say to me?
I said, if you don't do it, I'll probably do it myself.
Wow.
But I didn't know what I was saying at the time. Now that I've been in it for 3 years.
That is actually kind of crazy because, we've been having groups come up from different listeners from across the state, across the country. And I feel like a question they have every time is like, where do you find the Jims? Where do you find the Marshas? Where do you find the Matts? And, are you tapping on people that are already in your paid staff of the church and having them stretch themselves really thin and they're also doing teen ministry and healthcare? No, God just raises up people.
He did.
And so it's that's my question is why did you think to call on Jim? Why did you say yes? Could there be a listener now who's I have this dream and this vision to start this thing. Who could I call? I just think that's cool that Ed called you and God was already working on you.
I think it was God ordained.
Yeah.
Without a doubt.
So then what happened? You were in Florida. You were
Yeah,
like, "Yep,
well,
I'll do it."
Yeah, I said I'll get working on when I get back. And so because I'm a project a project manager. I've got a methodology in terms of what's the business case, what's this going to cost, what's the budget, what's the need, the problem statement, going through all those steps. And I just started working on that when I got back. And Ed's not a big one for reading my huge documents, but I think he did wade through it. But we had a business plan because you need to be able to sell it to people, because we obviously needed money to run this. I also really did a lot of research on the need. So I looked at a lot of government sites, United Way sites, how many people are uninsured in the area. And there's just a lot of data on that between the census and other groups that collect that kind of data. And so I had a lot of facts. It's overwhelming, the need out there. Then also took advantage of our Bridge Food Center to do a survey with, really our target population, and interviewed, basically gave them a $10 gift card to sit down with me for 10 minutes to go on a computer and answer, I don't know, there must have been, 75, 80 questions.
How many people did you interview?
Over 100.
Wow.
Yeah.
Okay.
And to get an idea, so I kind of felt like we had our bases covered, that, this is a smart thing to get into. There's a lot of people that could use our help.
Okay, so then what happened? Like, what was the first step beyond now you've gathered all of the data? I could only imagine. I would be overwhelmed. Like, I'm just overwhelmed listening to, like, absorbing all of that and being like, okay, now where to start?
Yeah. Well, that's God again, because God was already working on a different angle through Ed. And I'm going to let Ed share about, the clinic that we ultimately ended up taking over. But I mean, that was a huge catalyst for us, because without that clinic to help us kickstart this thing, we'd probably still be talking about it. But Ed, why don't you share?
Well, it goes back about 12 years ago that we had a PA, a physician's assistant, going to the church, and we were just dreaming. I remember we met, and we were just dreaming about maybe working together, doing some project to do healthcare together. And then life happened, and he was still in the church, but kind of went off doing different things and working different places. And then he came to us back in probably the fall of 2020 or 2021 and just said, remember, we're coming out of COVID. And he came to me and he said he had started a clinic in COVID, and he loves doing the healthcare. He loves being a provider. But a lot that goes along with running a medical clinic is it's really like a small business. And he told me, he said, I really don't like the business side of it. I really don't like the administration and the running of it, but I want to be the provider. So he just said, would you like it? I mean, and I'm like, you want to just give us your practice?
I think that's when I got the call, by the way, wasn't it?
Probably.
Okay.
We were just given a practice that we can take it over. But again, the cool story about God, let's go 5 or 6 years earlier than that. We had somebody who was in the church, and they had a piece of property, and they invited me to their house one day and said, we're considering giving it to the church. And if we did, what would you do with it? And I said, well, actually, the greatest need that I see in the community is affordable health care. So I'd like to use that money for health care. And it was about $45,000.
Oh.
And only to find out that the wife actually was in like a low-cost healthcare down in Saginaw for quite a while. And I didn't know that. So they were like, we love that idea. So they donated the land, we sold the land, and we just parked that $45,000 and kept it there for years and years and years and years. So when this came along, we had some seed money.
Yeah.
Huh.
So we made a
know
deal.
that.
And he actually sold us all of the contents for a very reasonable amount of money.
You and the provider.
The current provider that was in there. Not current, but I mean at the time.
Okay.
time.
Yep.
So we purchased everything, all of the equipment, everything that was in his facility. And we changed the name, and it became Gateway Healthcare. And then he stayed on as the provider.
Huh. So, okay, but surely it would take more than $45,000 to run the thing, right? Or is
Oh yeah,
so
Not
where
to
did
purchase
you?
it, but to run it, yes.
yeah.
Okay,
yeah.
so but purchasing it, like that's kind of all it took, and then from that you just kind of had to create like a sustainability model
Right.
to fund it.
Right.
Okay, so what was that the next step then?
That's a good question. Was that the next step? I tell you, this whole thing's been a leap of faith. That's all I can say.
What in the world did we get into?
We had
asked
no
ourselves.
idea how busy we were going to be that first day. I mean, we didn't know if there'd be 100 people lined up or there'd be nobody. Me personally, I've really had to just trust God. That it will come. So as much as it went against my grain as a project manager, those initial, getting started up in initial, months, I could see, we're okay, kind of like what, I've said on the previous podcast, we're okay for about 3 months. and that's been kind of the story.
Okay.
And we had a lot of people cheerleading us on, didn't we, John?
No, actually not, Ed. People
what were
thought
people
we were
saying?
crazy, to do this.
Still are.
They thought we were, they were not. We were nuts. But I think again, back to the need is there. You got to try to do something.
Yeah.
And our hearts are in the right place. We feel we're being obedient to God, and that that He'll provide. And so far that's exactly what's happening.
And honestly, I feel like you guys kind of told an easy version of what that was actually like. Because, like, how many doctors, providers did you interview to find the one?
We talked to a lot of people because we needed we had the clinic and the provider, but a PA requires a medical director, so do nurse practitioners. But, we didn't want to go with his medical director. So we needed to find one. And
simply because he was out of state.
Yeah, he was out of state. We needed somebody local. I think we talked to, over 40 people to try to find somebody. And that took us months and months and months and months to find somebody, and a lot of effort. Yeah. But without it, we really couldn't get started because we had kind of committed that we were not going to use somebody out of state.
I don't know how we continued. I mean, when you heard no, and if I remember, it was 52. That's the number that comes to mind. That we got 52 no's.
Yeah.
And that was tough. It was just like, well, here goes another one.
And those were not just like quick 10-minute phone calls. Like, so I got here in October of 2021, and actually when I was interviewing was the first Sunday that you guys announced in church, like, hey, we're starting a healthcare clinic. And so it's been interesting. And so like coming on, especially like I had never worked in ministry before, and so I've always been in the church, but I've never been a part of a church that has a healthcare clinic. And so it was interesting to hear like the day-to-day, like, oh, you have another interview with a doctor, pastor, and chairman of the board. Okay. And so like those were, like I remember you sitting in your office and you were in the conference room on Zoom calls for hours. It would be like an hour and a half, 2-hour conversation for only it to be a no. Times 52 doctors, providers that you're interviewing. Like, this is not just like a quick call and nope, rapid reject.
It was a
it's
lot
like,
of work.
Yeah. So now that the clinic is open, are you finding that like all of your research in there being a need for affordable healthcare, are you finding that is actually a need?
Yeah, we are, but we are still struggling getting the word out. Okay. It's a challenge. The group we're going after, first of all, is generally not because of their money situation, not thinking about preventative care. All right.
Oh, yeah.
So then they're going to come to see us on an urgent care basis, and they're also, unfortunately, because of the expense, they're waiting far too long to come and see us. And so it's a tough group to get the word out to, and it costs money to do that.
Yeah.
So we're back to your earlier question. How do we balance where we spend our money at, and that's been a challenge. So we're not as busy as we'd like to be, but we're in a lot of different groups. We work with a lot of the agencies in town, the county health department. The need is there. The need is there. We got to get the word out more.
Yeah, and I think I even it is spreading. We have this group, this Facebook group called Ask Midland.
Yes,
and a lot of stuff is constantly going in there all day long.
Yeah.
And even I swear every day there's someone who will post, whether anonymously or asking, just the one this morning was hey, I have a 2-year-old. Is it normal to wait 2 weeks to see your primary care doctor?
Yeah.
And it's every time someone asks a question about hey, I really need help, I have this urgent need and I can't see my doctor until 2025.
Yeah.
And it's without a doubt, there's the stream of comments saying, go to Gateway, call Gateway, stop by Gateway.
Yeah.
And so the word is slowly getting out
slowly
there.
Spreading.
But the need is there.
Right. The need is there. Very convinced of that. And, part of the issue is we did work with a consultant on this. Again, another God moment, that a consultant that ended up being, a nonprofit themselves, that it's set up several clinics like ours, not quite. But, they say, it takes a good 3 years to get a practice like this up and running, because, you got to establish trust and credibility. You got to get the word out. I remember going to the first few, area conferences or whatever, and nobody would know about us. And a year later, I went to those same ones. Well, have you heard of Gateway? Oh yeah, I know, I've heard of Gateway. So it's getting the word out, and it's happening.
Okay,
but I'd like it to go faster.
Yeah, we all would,
because we're there to serve. We're there to help people.
So a patient walks into Gateway. What can they expect to see?
Okay. Well, first of all, we have a very nice clinic. And I don't know if you're able to show any pictures to the listeners.
We can probably work that out. Yeah.
But it's
high quality.
It's high quality. Yeah. The lobby is very welcoming. We offer coffee and tea and water and so forth. Our staff is, they show love. They show Christ's love to everybody that walks in there. When the medical assistant rooms the patient, besides going through all their medical history and why they're there and getting ready for the provider, taking their vitals and all that, they just ask a simple question. Would you like the provider to pray with you today? And if they say yes, we make note of that, and the provider prays with them, or somebody does. And if not, it's done.
And you've had some comments of this, people asking, what is prayer? This might be the first time somebody's ever heard or been prayed over.
Yeah, particularly with the sports physicals.
Yeah.
They're, you got a child and you got a parent. And in our ministry world, that's an awesome day when we get to see two people instead of one on a single appointment. And they, we get anywhere in those sessions to, the child saying yes and the parent saying no, to, what is prayer? And we sit down and explain to the child, this is what it is. And quite honestly, some of those parents are a little embarrassed. And I don't think that's a bad thing.
So can you think of some of your favorite stories from Gateway? Of course, being respectful of HIPAA and the patients.
Yeah.
But what are some of your those stories that tug on your heartstrings?
Yeah, there's so many, and I hope I don't get choked up on them, because it's really hard to see people hurting, especially because I'm so blessed. Why am I blessed? And these people don't know where they're getting their next meal from. They've waited too long to come and see us. They got so many issues. I mean, we had a patient in that we had bed bugs. We actually had to close the place and fumigate it. But can you imagine what their house was like?
Yeah.
And and they just the issues just go on and on and on, and it just it breaks your heart. But most recently, I had a patient come in that was Medicaid, and they just they came in and just are you taking Medicaid patients? Because a lot of providers don't, or they'll limit it because there's just no money in it. And I just got to talking to her about that, and talked to her about her food situation, transportation. She needed work on her car. We got her lined up for that. She talked to her about the Bridge Food Center and so forth. And just the look on her face made it worth it because somebody was helping her instead of, get out of my face.
Right.
Yeah.
And care for her in more ways than just what she showed up for.
Right.
Yeah.
But another story is when we were first open, I was talking to a young man, and he broke down in my office because he said, all I've been taken care of is my family. And he had heart issues, and he just said, thank you. I mean, you're, I'm going to get the help I need.
Wow. Wow.
Isn't that the gentleman that didn't have enough money?
Yeah.
We charged $40, and he had
$4. I emptied his wallet. I said, "Are you sure?" And he said, "Yep."
So why do you do that? Can you explain, everything?
Yeah.
Everything he had. Why?
Yeah. I mean, dignity is something that's very important to all of us. At least I believe it is. And I think there's people that want free handouts, I'm sure, but generally people want to provide for themselves and their family, and so when they can't come up with the $40, which we present to them as this is affordable health care, it's $40, but if they can't afford it, they feel like they're at least contributing something to their appointment, and they can walk out of there and go, I did pay for something here.
Yeah. So the most a patient will pay that is qualified is 40.
It's qualified as 40, yeah.
And then what's been the lowest?
$1.
Okay.
Yeah.
So there is flexibility.
I don't think we've done
there.
anything free. We hope we're not getting taken advantage of. We try to explain what we're doing and what our mission is, and we feel we're not, and leaving it up to them to decide. But we really push to try to get the 40.
Yeah.
Can I maybe clarify when you say, for those who qualify? It's very generous. So for a family of four, what's qualifying? How much do they have to make less than what?
I think it's $88,000 right now. Yeah.
Okay, so that's really generous when we say for anybody who qualifies, a family of four, two working parents or one working parent, $88,000 is very generous.
Yeah.
So you qualify every patient that walks in.
Right.
Okay.
Yeah.
Okay. And is that just in a questionnaire before, in all the preliminary paperwork?
We try to be very careful with that. We just basically say, hey, when you filed your taxes, how many people did you put in your household? Oh, you put 4. Do you make $88,000 or less? And,
okay.
We have a little chart that the staff does that with. That's why I'm not 100% on the 88, but I think that's what it is.
Yeah.
And they say yes, then they're qualified.
But what if they make more than that, Jim? We don't deny them.
No, of course not. Yeah, we serve everybody. I mean, we're
insured.
Yeah, insured.
Uninsured.
Well, that's again. Ed said no one was really challenging to us to do this or anything, and they told us do not do insurance. We had multiple people say do not do insurance, and I know why they said that. But the problem is we have a lot of Alice folks out there that have insurance. They get saddled with a premium every month, and then they have a $10,000 deductible, which means they basically have no insurance.
Yeah.
All right. If you're making $50,000 with a family of 4, are you going to run to the doctor because you've got insurance, but it does, you got a deductible? No. So we had to go get credentialed with all these insurance companies, and so that we can help those people as well.
What are some reasons that people might have barriers to healthcare?
There's a lot of reasons. The first is, obviously if you're uninsured, the provider knows they're not gonna, make money on them, So obviously the uninsured, have barriers. Those that, but the Medicaid patients, those in poverty, have huge barriers. There's no money in Medicaid. Okay, doctors take on Medicaid because they care for people too. Okay, but they can only take on so much. Because if if they fill up their practice with Medicaid, they'll be out of business.
That's crazy that you can just turn someone away also.
Yeah.
Well, I guess that makes sense if there's like a wait list or a caseload that's full.
Okay. Yeah, and I don't know how they get around it or whatever, but I get it why they do it. But they have huge barriers. They're also, we've stripped a lot of the benefits in this country. To the point where the people that do get Medicaid, what we see, they generally, by and large, absolutely deserve it. So many people are hard on the welfare system and this and that and whatever, including myself in my past life. But seeing the people that we're seeing and the problems they're facing and the issues that they have, they need help. That's all there is to it. But the Medicaid programs in this country are very minimal, and in terms of what they pay, they are getting better. We've even seen that since we've been open. We're starting to get a little bit more money out of Medicaid, but they're not patients that providers are going to just go, oh yeah, that's the group I want to work with.
Yeah. What's been the most challenging thing?
Oh gosh. Everything. How's that?
Is there anything that's been easy?
No, I don't think anything's been easy. It's challenging from a lot of ways. I mean, it's definitely a test of your faith because this is God's clinic. I mean, it's His all the way, and I always challenge myself every day. Am I working on the right stuff? Is that really where I should be spending my time, or we should be doing this or that or whatever? That's a huge challenge for me. Money's always going to be a challenge. We cannot provide these services at affordable costs, without donations and getting money. It's just not possible. We had a huge challenge a year ago when we had. I don't think I mentioned this, but it took us about 18 months to get us open from the beginning to, once we decided to go, I think it was about 18 months. We ended up losing our provider and medical director.
In one day.
Yeah.
How did that happen?
And we only were closed for 6.5 days.
Wow.
And we moved.
And yes.
And so you can't tell me God isn't watching over us.
Yeah, that was miraculous.
We get to see, you talk about challenges, but you also ask, well, what goes well? I mean, the miracles we see are unbelievable.
Well, talk about how that was addressed, because you're without a medical director, you're without a provider, you're moving.
Yeah, it was crazy.
How did you stay open?
Well, at about the same time, I got an email from Sean, who I think we might have mentioned, one of our providers. She stumbled upon us and sent me an email and just said, I'm interested in volunteering. This was before, I think it was like the week before everybody quit. And the week after everybody quit, we met with her again because, she says, I'm interested in volunteering and this and that. And we met her a week later and said, well, how would you like to just come and work for us? And she said, yep. And we had a board member that was a nurse practitioner. And she said, well, I can cover the days she can't do it. And it was like, you got to be kidding me. I mean, it took us 18 months to get this going.
And you moved
we were closed 6.5 days. That's all it was. I mean, I don't even think our listeners would believe this if they're in the medical profession, that we could possibly do that.
Well, take it a step further, Jim. So when we moved locations, insurance companies didn't follow.
Oh, yeah. No,
and then
no.
Now we have 2 new providers within just a week or so, or 2 weeks.
Yeah.
And how many months was it before we ever got paid? Unless you paid cash, it was
Oh, yes.
3 months, 4 months
Oh,
before we ever saw a dollar.
3 to 6 months easily.
Wow.
Yeah.
So, I mean, think about operating a clinic, month after month after month, that the only ones that are paying are those who have cash of $40. That was it.
Yeah.
That was the whole revenue that was coming in. But we had to pay the providers. We had to pay the
Pay
bills.
the rent,
we had to pay rent.
pay utilities and supplies and
That was a tough
yeah.
time.
Oh my gosh.
But
yeah.
God saw us through that time.
Yeah. Oh yeah.
And even just moving too, like you moved into a really nice facility that was
Well, it had
like,
to be, the only thing we had to do was paint it, but that was
yeah.
that was a big job.
But even that too, it's
Yeah.
like however many days it took to paint that, weeks where it's like you guys kind of just sectioned off the building,
Yep.
and as patients are walking by, they only saw what
Saw
was
what
like
was painted.
yeah, but then it's like if they only knew what was on the like
Right.
rest of the half of the building. But people I heard were just like so gracious with that too, and patients coming in of like, I think they were just amazed by the clinic, and then they saw the paintbrushes in the background, and they're just like, wow, yeah, no problem.
Yeah.
So you guys came up with a pretty incredible thing that I think a lot of people need to hear about, being the share plan. So can you explain why that was created, what it is?
Yeah. I'll
I don't
let
know, who
Ed,
wants to take
Ed address that one. That's his brainchild.
Well, the share plan was really created because we know that there's a lot of people that are working ALIS. We specialize in ALIS, and they're not insured. And so just in talking with business owners who have people that can't afford insurance, is there something that Gateway can do to help businesses? It's rare, that churches, and if you think about Gateway as a ministry that the church had begun, it's rare for churches to be able to serve business owners. Normally churches go to business owners and they have their hand out and they're saying, can you give me something? So we really had them in mind, and how can we help them? How can we help the business owner really become like the hero of his own employees? And if we can do something that's affordable, so how can we make healthcare affordable for the business owner to pay for, so that the employee would have insurance who normally would not have insurance? But this is not insurance. It's just healthcare. So we created this really simple thing called the share plan, that if you're an individual and your employer is willing to pay $8 a week, that the employee would get 4 medical visits, including an annual visit. And the annual visit includes labs and anything else that they need. So, it's a lot of money for an annual visit. And so if there's 2 people in a household, so you have a spouse or you have a child, then it would be $14 a week. And if it's a family of 4, then it would be about $20 a week. But then you would get, so 4 visits, 8 visits for 2 people, 16 visits for a family of 4. So I know that the insurance that we pay for a family of 4 for an employee is about $17,000. And we can put together a health plan, not insurance. I just want to be really clear. It's not health. It's not insurance. That they pay $1,000 for a family of 4.
Wow.
That the employer does, and then the employee pays $15 a visit, which is very reasonable. But it's called the share plan because if you get 16 visits, one person can use all 16, or you could split them, 4 ways, however you want to do it.
Or, brother or sister can
Yes.
take one, and
Yes.
whoever in the family. Okay.
So it makes the unaffordable for employers affordable for employers, and it makes the unaffordable for the patient who, I just went to a provider, a chiropractor yesterday. It was my first visit. It was $180.
What?
So for the first visit, he said, now it'll be less when you come back.
Right.
But it was $180. So put that in perspective. What we're offering to an employer is when the patient comes in, it's $15.
Wow.
That's all it's going to cost. So we made it affordable for the employer. We made it affordable for the patient. And really what we want to see is the whole community have the best health care. Jimmy, you can talk more. So let's say they come in for a visit and it's more than we can provide. So they need something beyond that. They paid $15,
Right.
or they pay $40 if they're uninsured. Walk us through what happens then?
Yeah. Whether you're in the share plan or whether you're just a patient coming in, it really doesn't matter. We do a lot of referrals, and what we do is we qualify them also for our local hospital. All right. we don't officially qualify them because we don't work for the hospital, but we give them their paperwork. We help them fill out the paperwork. We've even printed off, W-2s and 1040s for them and whatever else, and send them over there with their financial aid, because our hospital, a local hospital here, is excellent. They've got a great program, and generally for the people that have qualified for us, qualify for them, and their services end up being at no charge.
Wow.
Yeah.
And you've sent hundreds.
Yeah,
of
we've sent
patients.
hundreds. Oh, yeah.
Maybe talk about how many patients that Gateway has seen.
Yeah, we've seen over 1,500 patients since July of 2022, with over 2,600 visits, and just making a real impact on the lives of people.
Yeah.
But I think there's something to be said there about those numbers, that it's almost like 1 out of 3 patients that come, that we've referred them on to the hospital.
We refer a lot, and because they're coming in and they've got and that happens with your primary. I mean, gosh, I've got a urologist, I've got a cardiologist, I've got a dermatologist, and these folks are no different. I mean, when we see an issue with something, we have to refer them to a specialist.
So if I can jump in, so talk about the name Gateway, Jim.
Yeah.
Because I think this is actually, why did we call it Gateway?
Yeah, you got to answer that one, Ed. That's
Well, I'm happy to. Thank you.
because it took us a while to come up with this name.
It took us a while.
We at one point, I think we were thinking of naming it like the garage, His Hands Healthcare, and thought, that
really?
could be that doesn't sound right.
doesn't sound right.
Gosh. Oh.
His
It
Hands.
doesn't sound right at all.
That sounds like
Yeah.
Moving along.
not my kind of healthcare.
All right. Get those images out.
All right.
Okay, Gateway.
Sorry about
So
that.
Gateway.
We called it Gateway because we know the Alice community. And we know, and in fact, even one of those interviews that we had was with somebody at the hospital. And we wanted to get them to the hospital to get the best coverage. Yeah. We knew our limitations. And so knowing the Alice community, we wanted to be the gateway to the best healthcare possible. That was one half of it. But then we could flip that coin over. And Jesus said, enter by the narrow gate. And so we wanted it to be a place where when people came in, they would be prayed with. And the prayer, understand what it is for us, is we're inviting Jesus into the healing process. And before 1900, churches were the ones that were doing most of the healthcare. And then about 1900, we separated it out, and we had physical healthcare, and then you had a chaplain. And Gateways just brought those back together. Jesus being enter by the narrow gate, so we're going to invite him into the healing process when they start at Gateway. But then it's wonderful. We get to send them in now we're going to make sure that you, not just from us, but you're going to get the best healthcare possible without the price tag.
Mm-hmm.
Yeah.
It's amazing. Actually, what Gateway has done for the community is nothing short of miraculous and has really increased the well-being and the health of a community. And that's the hospital's mission. That's part of our mission, is to provide the best healthcare.
Yeah. Well, Jim, thank you for being here today.
Absolutely.
And thank you for just sharing your heart and your ministry and allowing people to see just like a piece of Gateway.
Yeah.
I would say we always give listeners something to do before they go.
Oh, okay.
So I was going to direct people to website, social media. I mean, we're on Facebook, Instagram, LinkedIn. So you can just search Gateway Healthcare, Family and Urgent Care.
Right.
And then website is gwhealthcare.net.
Correct.
Okay.
That's it.
Is there anything else you would give listeners to do before they go?
Keep praying for us.
Yeah.
Well, I think this might be good. Can you just take it a step further?
Yeah.
If somebody wanted to be a donor for that person who shows up at the window and pays $40, and they're standing next to a donor, that's how we want people to imagine it. So talk us through that, Jim.
Yeah. So there, we like we said, we charge up to $40, and we figure our visits are, if we can do 2 an hour at $75 an hour, or $75 a visit, we're probably, pretty close to breaking even. So if, imagine a patient coming in, we tell them, it's $75, they've got $40 to pay for it. And the person next to them, like at the checkout lane, says, well, I've got $35. And then they pay for the visit. So, yeah, we'd love a donation. I mean, if there's listeners out there that would be interested, again, go to gwhealthcare.net. There's a link there to donate, or gwhealthcare.net/donate. And or you can mail us a check, and our address is on the website as well.
Awesome. Well, thank you, Jim, again for the conversation today, and we will see everybody next week.
All right. Thank you.
Thanks for tuning in to this week's episode of Beyond the Breakwater, a podcast of Elevate Community Ministries. Don't let the conversation stop here. You can email us at hello@beyondthebreakwater.org. We would love to chat with you, answer questions, plan a visit, and help you take your next step. We'll see you next week.